Welcome to
back
the podcast.
Welcome to the Visceral Voice Podcast.
Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider. Through this podcast, I aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between. I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement specialist, and a manual therapist. Join us as we strive to provide current, knowledgeable, creative, and compassionate information to help you restore, regain, and create happiness and success on your vocal journey. Hello, everyone. Welcome back to the podcast. I am so excited to have Sarah Brown with me today. Sarah is a singing teacher and a licensed speech pathologist based in New York City. Before launching her own voice studio and going into full-time private work, Sarah maintained a clinical caseload at the Voice Center of Mount Sinai for 5 years, as well as an adjunct faculty position at Pace University. Her research has covered a wide variety of topics in voice, and she has presented nationally at the Fall Voice Conference. Sarah also regularly teaches singing masterclasses, most recently with Yale University School of Drama. Her specialized combination of singing background, performance experience, and clinical experience have enabled her to serve Broadway performers, Metropolitan Opera singers, and TV film actors. She holds a Bachelor of Music and Vocal Performance from Chapman University and a Master's of Science in Speech Language Pathologist from Northwestern University. So Sarah, thank you so much for joining me.
Thank you for having me. I was so excited when I got your message about this.
Yay! I've been wanting to talk to you for some time, and so I'm so stoked to have you here.
Hey, so appreciate it.
So your journey is just a little bit different than maybe somewhat similar, but I love the fact that you've taken your speech therapy knowledge and expertise and really, really brought it to the performance habilitative component where you're bridging the gap between rehabilitation and habilitation. So I'd love to hear about your journey and how you kind of came into the speech pathology world, had 5 years of clinical experience, and then decided, though you still do work with, you had mentioned before we were started, about 10% of your population is still some rehab, but how you kind of bridge the gap. I want to hear your journey of what led you to where you are now.
Yeah, cool. I know it is kind of funny hearing you pose the question that way. A lot of speech pathologists who go into voice therapy, they do have a singing background, but usually they go singing background, maybe some voice teaching into speech pathology, and then kind of stay there. And I kind of did that, but then went back to the performance world. And so I guess that piece of it is a little bit atypical in comparison with some of my colleagues. So I have an opera degree from undergrad. And during that time, my junior year, I actually started to have these really weird technique issues that nobody could quite pinpoint down. It really was just that I was quite discoordinated with my voice, but so much so that I was creating two tones at the same time in my first passaggio, not on purpose. And there was no injury. Normally when we hear two tones at the same time, we think some kind of polyp or something like that, making that extra tone, but there was no injury. There was nothing notable in my exam. And so I worked with a number of different teachers trying to figure out what was going on. And wasn't really receiving that help. And I was able to finish my degree okay and kind of get through my performances. But I realized I was going to need to switch careers, at least temporarily, while I tried to figure out my voice. So that's when I decided to apply to speech pathology school. I had learned about voice therapy at some point in college, although was never referred for it, which in hindsight, I think that would have helped a lot if I had been referred for voice therapy, but I wasn't. I had heard about it from a guest lecturer at our school and thought, okay, that might be a nice like career to start building, and it'll give me some room in grad school to maybe still take voice lessons with somebody. And so I ended up in grad school for speech pathology, worked with a new teacher who was at school where I was, and she really helped me be able to figure out a lot of those coordination issues. And funnily enough, she was doing a lot of the strategies that I was learning about in voice therapy training at school. And it was cool to see that parallel of, oh, I'm learning about these therapeutic rehab strategies here. And then I'm also getting that from this voice teacher who's actually starting to help me make some progress with these issues. And so I think it really just fostered my passion for it more and more as a singer, but then also as a burgeoning clinician. And I ended up taking a clinical fellowship position at Mount Sinai right after graduating at their voice center, and was able to stay on that team after the fact, which was such a blessing, and did almost 5 years there, working mostly with voice, upper airway, and swallowing. So I did a lot of speaking voice, a lot of singing voice rehabilitation, especially by the end of my time there. I was sort of the singing specialized person before I left that position. But I also did a lot of swallowing therapy and evaluation and chronic cough. And I think that extra clinical background in some of those facets outside of voice also greatly informed my understanding of the anatomy, or just at least some different presentations of anatomy, working outside of voice as well.
Mm-mm.
Yeah,
That I would think would be very beneficial post-COVID with a lot of
yes,
people who had continuous, cough, et
totally.
cetera. So how that can come in handy, that information, and having worked with that demographic.
Yeah. And I guess again, I did about 5 years, and then I happened to pick up a couple private singing students during that time, and both through word of mouth from those students. And then also I started posting on social media during the pandemic because I was bored and we couldn't do anything. And also there was a lot of misinformation online about voice therapy. And so I thought, hey, I might as well put together some content. And that ended up becoming a big like hobby of mine. But that social media outreach also helped me be able to have enough of a marketing platform to attract students. And so between word of mouth and Instagram, I was able to attract enough private voice students to eventually go private full time.
Yeah, you're so good at it. Oh my gosh, I'm terrible at social media.
Yeah,
It's true. I put it out. Everyone knows I am not technical. The fact that I can even, turn my computer on to run a podcast.
okay, please, you're crushing it.
Oh, so you had mentioned that when you were going through everything in undergrad with your own voicing, and that speech therapy was never mentioned. And I
Yeah.
just kind of want to like hone in on that and pause on that for a moment, because when I went through my major thoracic surgery, with a lot of, 12 ribs, my xiphoid process, my sternum, all either
Yeah.
removed or at least, surgically
Yeah.
changed. I also it was never mentioned to have any form of physical therapy, any kind of breath therapy, nothing. However, I do want to say that sometimes, and I understand this as a practitioner now,
Yeah.
that we say things so often that we think that everyone knows,
Oh, totally.
and they don't.
You
Not
don't.
everyone does.
No.
So even though I might 5 out of 6 times
Yeah.
start with breath with people, that sixth person doesn't hear it, and then 10 minutes into a session, I'm like, I have to ask them to start breathing because they're holding their breath.
Yeah, totally.
We as clinicians are constantly hearing ourselves say the same things. And I
Totally.
do want to just mention that aspect of it when,
Yeah.
when the doctors aren't referring, because for many years I was like, why didn't they refer me for this? They should
Totally.
have.
I know.
And,
Well, I think the first the person I saw, I just think he didn't know any better really because he was a general ENT who had some voice specialization, but he was not a board like laryngologist, whatever, fellowship trained laryngologist. So I do think for him, he just didn't realize that maybe a singing voice specialized voice therapist would have been the right fit. I think he just didn't put that together. He thought, oh, there's no injury, so working with your singing teacher would be fine. But the second laryngologist I saw, he actually misdiagnosed me with a neurological dystonia and told me I would never be a professional singer. And I asked if I could do voice therapy, and he said no. Anyways, so that guy actually didn't help. But the first one, I think, just didn't know any better. And it does kind of speak to the point of if you're a professional singer or performer at a high level, you need to see a laryngologist because they're going to have more awareness of what things might be possible for you theoretically.
If someone's in an area where where there are no laryngologists, so say they're experiencing something, they're a professional singer and they have to go to an ENT who isn't specialized specifically in laryngology, would you recommend that they just go ahead and seek out ask for speech therapy as well?
Potentially, they could at least ask for an evaluation because the ideal, I think, gold standard evaluation would be both a surgical medical evaluation with a doctor, an ENT, and then also a behavioral evaluation with a speech pathologist. And so they could certainly request at least an evaluation with a speech pathologist who specializes in voice and have that person determine if behavioral is warranted at that point in time. I also think a possibility too would be to make sure that the ENT has stroboscopy and then get the video from them and then potentially set up a telehealth appointment with a laryngologist who is at least in their state. They might not be local enough to them for them to go travel to see them, but if they're at least in their state, they should be able to do telehealth with them and they could then send the video and get a second opinion that way, as long as they could get that video, make sure it has stroboscopy and all of that. So that would be another way to get additional information.
That's really helpful. Thank you for mentioning that.
No
I'm
problem.
so sorry that that was your experience. And
Thanks, that's okay. I mean, I think it contributed a lot to where I got to, so it's okay. But at the time, it really sucked.
yeah, for sure. And
Yeah.
the amount of artists that we see who experience even just experiencing a diagnosis, let alone a
Mhm.
misdiagnosis,
Right.
and what that can do to our psyche
Totally.
is really impactful
Yeah,
and scary if we hear that.
totally.
So I'd love to just, briefly run down. I've been wonderfully blessed to have some speech therapists like yourself on the podcast. And so we have some of what are the roles of a speech therapist?
Yeah.
But because you really 90% of your practice right now is as a voice teacher who has the expertise in speech therapy. So what are some of the differences and the similarities of speech therapy and of your voice teaching training?
Totally. So I think in some ways a kind of good comparison actually would be the difference sort of between a physical therapist versus a personal trainer. I think the speech pathologist role is when there's some kind of function that has been lost. So whether that's range loss or a stamina loss, or there's some kind of injury or muscle tension issue, and that singer has lost their ability to do something they used to be able to do, the speech pathologist role is to help restore that function. And it's more of a short-term rehabilitation process. You don't usually continue to see them long term. You might check in with them once in a while, but you don't regularly see them long term. Versus a singing teacher's job is to maximize a singer's potential. Hopefully their baseline is sort of a healthy-ish function. At least it's functional enough to participate in singing lessons. And your job is to maximize what their voice can do. So you're doing potentially really athletic things. You're increasing their pitch range. They're maybe working on belting or something like that in that context. And that ends up being a lot more long term. You could work with someone for their whole life, and still always be learning about your voice. So that relationship actually is one of the things I think I like a lot about the singing teaching position, is that I get to have a much longer term relationship with my clients, and getting to see the progress. You see progress in the short term, but getting to see the long term progress at a year out, 2 years out is so cool, in a way that I didn't get to see sometimes that as much in the speech pathology role. You'd really only see that 3 to 6 month progress. So That's actually one of my favorite parts about the more singing teacher role. One of the other big differences too is that speech pathologists specialize in speaking voice, assuming they are a voice specialized speech pathologist, whereas singing teachers don't necessarily specialize in speaking voice in that same way. They might have theatrical speaking training or some training in voice therapy techniques, but it's a very different level of experience to know how to rehabilitate a speaking voice that's having a problem than it is just to train some resonant strategies for the stage. Though those two skill sets, while a couple of things overlap, it is just a different thing to have that much clinical experience in speaking voice. And so I think that's one other big difference of why a singer might be with a singing teacher versus a speech pathologist.
Yeah, that's a really great point and a really wonderful component about what you are able to provide to the singers that and artists that you work with. Because I do find a lot of the artists coming in that are like, I keep hearing that it's not my singing voice, it's my speaking voice,
Yeah.
And then you're like, yeah, yeah. So you're having
Yeah,
to work on your speaking voice, right? And so to
totally.
be able to come to, kind of a one-stop shop and be able to work on your speaking
Yeah,
voice and work on your singing voice and making sure that you're maintaining your health, the health of
totally.
both your speaking and moving it into singing is just awesome. I love that you've bridged the gap between rehab and uh, optimal function
Totally.
and to bring someone in between. That is in many realms because that is true in the movement realm as well, from physical rehabilitation to habilitation and to optimal habilitation. There's this gap between the two. It's like, okay, you're done. Like you finished your 12 sessions. And the person's like, really?
Okay.
Because I still feel pain here.
Right.
So to bridge, that's where I like to come in with some of the movement stuff that I do.
Yeah.
Before we got on, I had mentioned I don't really come into strength and conditioning and powerlifting and any of that stuff. I will refer to someone else, but I
Yeah.
do like helping someone from that rehab component into more of healthy movement strategies. So I love that that's kind of the realm that you're in with your people and then being able to continue with them, which I
Yeah.
agree, being able to have clients that you have worked with for years and watch them progress it's life changing. It's
That's the
what,
best.
yeah, it's like what I'm so passionate about.
Yeah, totally.
um Cool. So I want to kind of transition because I want to kind of pick your brain about gargling and about
Totally.
semi-occluded vocal tract exercises. So let's start with gargling. One of my favorite things.
Yes.
I like talking about gargling. I love gargling for myself, and it is amazing for a lot of the people that I work with. I always talk about kind of finding your inner amphitheater.
Totally.
Um, but what's interesting is that many people, when they first start just gargling water, even without phonation, they really struggle with it. And then
Mm-hmm.
adding phonation and then adding any kind of pitch change, it's like, oh, I can't. So I know that you had a post several weeks
Yeah,
ago, I think, about gargling. So I just want to hear your thoughts on it, how you use it.
totally. I love gargling so much that there's two exercises I do with every single person at their first lesson with me as kind of an assessment tool, and gargling is one of those pieces. It's not always the right fit for every single person, but when it is, it works so well. And actually sometimes them choking quite a bit on it is a sign that it's a really good exercise for them, as long as it's not so much so that it's diminishing returns or something, but them kind of choking on it and then being able to work through that actually to me is a sign that it's probably something they should be working on.
I did when I
Um,
first started,
yeah,
but
totally.
get to a point very quickly that you're no longer choking on it.
Yes, totally. Totally. So I first learned about gargling actually as a vocal exercise in speech pathology graduate school, and they were using it for functional aphonics. So meaning someone who has so much muscle tension that they're talking like this. Like there's no
Mhm.
voice coming out, but there's no injury. And so it made sense to me that, okay, clearly this is used for really severe muscle tension. It must also work for just kind of muscle tension in general, I would assume. So when I started using it a lot was when I was at Mount Sinai. If I thought that someone might benefit from thyrohyoid space manipulation, but they were too tender for it, I would
Mhm.
have them gargle for 2 weeks. They would come back and suddenly they wouldn't be as tender in that spot, and we could actually create a little more space there. And so to me, that was like, okay, clearly this helps with the muscles outside the larynx just from that anecdotal experience. But fortunately, someone actually put out a study. And so in
Yay,
2020,
because I clinically have found the same thing.
yes,
Okay,
totally.
tell me about this study.
In 2020, they found that gargling for 1 minute reduced the electrical activity of the extrinsic laryngeal muscles, and that about 70% of the participants felt an improvement in voice after. So it's just a nice kind of like summary study that this seems helpful, and it seems helpful specifically for the muscles outside of the larynx, which I think is consistent with what I was seeing with the whole laryngeal massage component.
Mhm.
And so, yeah, so for muscle tension, it's really one of the best ones, I think, for larynx muscle tension. 'Cause that's so hard to train. It's really hard to train with someone's mind to be like, keep your larynx relaxed. That's not an easy task to do. And so I think this gargling is so much more tactile, which is really nice. And it's also a flow-based exercise. So it's also considered in the flow phonation battery of exercises within speech pathology. So any sound that helps you regulate your airflow, speed, and steadiness is considered could be considered a form of flow phonation. And so it's also very helpful for maintaining steady airflow. So I think it helps people maintain that steady airflow while not over tensing any sort of musculature. And so it's a really nice winning combo. If someone's choking, it means they're either stopping their airflow or they're gripping something muscularly. So if they can figure out how to do it, it usually can be really helpful.
Mhm. It's interesting now where I am in my cycle of life as I'm perimenopausal now, and the different because I know my voice, the
Mhm.
differences of voicing as I've come into perimenopause. There have been times where I'm like, am I getting like spasmodic dysphonia? What's happening?
Yeah.
I get glitches, and the being able to use gargling is voice changing for me, especially
So
through
cool.
this, as my hormones change and as my body is shifting and changing, it's night and day difference of what happens for me in my voicing.
Yeah, I think it can be also so helpful and sort of a backdoor approach to making some change because it's so reflexive in nature. That's why it works for functional aphonics or people who are just so functionally tense. If you tip the water back there, even if you choke on it, sometimes your body will still try to exhale the bubbles so that you don't choke. And so
Mhm.
it can kind of help because it's so reflexive. It can kind of help break any weird muscle tension patterns that are creeping in from a change like perimenopause or a change like after you were sick, you had a cold and you're coming back, or anytime there's a little bit of sneaky muscle tension coming in, it can be a reset because it's so reflexive in a way that straw phonation is not reflexive, for
Mhm.
example.
Mhm.
Um, yeah,
Also with kind of choking, like if you've choked on food or if you've
totally.
been consistently choking on food, and how the body responds to
Yeah.
that. And then you come back to gargling and it's like, ooh, no,
Yeah, totally.
okay.
Then it
This is what you want me to do. Yeah.
it's such a good reset. Yeah,
Being
it's
able
actually
to
what
just,
I recommend after people cry as well. So if people get really choked up from crying, I usually recommend gargling as a reset for the same reason as that,
mhm.
actually, as the choking.
Anxiety could be good too because of
Yeah,
the vagus nerve, the pharyngeal branches, all of,
totally.
so good.
Yes, we love gargling.
We love gargling. I love it. I love gargling. And it's amazing to me how many voice teachers I talk to and how many, different artists that I see. I was going to say students, but I'm not a teacher in that way. How many artists that I see that have never gargled, they've
Totally.
never experienced gargling. I'm like, wow, it's one of
Totally.
the first things I want people to do because
Yeah,
it's so impactful.
totally. Again, it's one of the two exercises I do at every first session, and that's actually a requirement of my associate teachers as well. We have a first lesson protocol, and they must try those two exercises for that reason because it's really helpful. But I think the research on it's still really new. I've even heard some resistance from some really prominent voice teachers in the industry who like are not into gargling because there's no research. I'm like, there is from 2020, okay? And then there's also the experiential clinical expertise research of you see that it helps someone, therefore it's helpful, you know? But
Which is all often, I feel like we find clinically like 4 to 5 years, we see a pattern
yeah.
clinically before the research actually comes
Oh,
out. And
100%.
theorizing here when I say 4 to 5 years,
Sure,
but it's often like we see things clinically before
right.
we ever, that's
It's
that's
a big
how we decide to do the research because we're seeing something clinically.
yeah. So I hope it'll become more mainstream. I certainly try to post about it at least periodically so that the word gets out that it's a cool exercise. Yeah,
Mhm.
so hopefully someday.
Yeah. Who shouldn't do it?
I know. Oh, good question. I do think someone who is prone to potentially dysphagia, I might not have them do it. So most adults have a little bit of age normal dysphagia any point after probably 65 years old. And so I'm a little more cautious sometimes after that age point of trying it. It might not be the first thing I do just because I haven't gotten to know their instrument yet and or know their swallowing capabilities or
Mhm.
their body's reflex. If someone's choking to the point of diminishing returns on it, meaning like they're like spitting out the water, their eyes are watering, they look so uncomfortable, you know what I mean? Like that would be not a good fit either because it's just too intense for them, at least in that moment. And not that they won't forever be able to do it, but just in that moment, it's probably not the right fit at the least. And then anyone who does it, but then feels like, oh, my voice feels weird after. I have had that happen once in a blue moon, actually.
Mhm.
I think sometimes with gargling, the tongue can get a little bit tight if it's not being monitored. And so that's one reason sometimes I'll see someone's voice get a little worse after is if we haven't really addressed tongue stuff yet, they might be using the back of their tongue to cup the water in a way that's not efficient. And so then that would be a reason it might not work for them. So once in a while, I will have someone sound a little bit worse after and I'll scratch it off the list.
Mhm. Could you start with some like base of the tongue drills ahead of time and then go into it?
Totally. Yeah. And
Mhm.
that's whether in the short term in that moment, try that, or just cue them to bring their tongue more forward while they do it and to make sure it's not over retracting. For some of them, the tongue stuff is so almost inherently ingrained, it takes like some time to undo that. And then I'll bring gargling back a few months later. So it depends on how quickly they're stimulable for that change in the moment or over a few months.
Mhm. Yeah, that's so helpful. I have not ever had it not be beneficial for
It's
people that
very
I've given it
infrequent.
to. So, yeah.
It's not common, but it's very infrequently, maybe like two or three people a year. And yeah, that's I don't know, I see 30 people a week.
Yeah. I do see how I do have an older client who's 85
Mhm.
that um someone like him. So I do see how
Yeah,
maybe someone in an older population, it wouldn't be the best drill for.
totally.
Um, but it's so rare that I have someone of that
Yeah.
age. So
Yeah,
just
totally.
in my clinic, but in other clinics,
Yeah.
they're definitely there just in my clinic because of the demographic I'm working with.
Yeah.
Um, cool. So when we're going to kind of transition now into some semi-occluded vocal tract exercises. So these are all over the place now. They're all the rage. I mean, I want to say everyone knows about them, but again, I'm assuming that everyone knows them. Many, many, many people know about them. Speech pathologists are using them. Voice teachers are using them.
Totally.
Clinically, in my setting, I will have the people come in who they haven't worked for.
Hmm.
So a lot of times someone comes in and they're like, I'm trying to do these exercises. It feels really bad. And I don't know what I'm doing wrong. So it's
Yeah.
kind of a like, what's wrong with me? Why can't I get this? It works for everybody else. What's happening? So I want to dive into what's going on with semi-occluded. Well, first we can explain what they are, what's actually happening, and then kind of transition into why they might not be helpful for some people and how to kind of modify that.
Yeah, completely. So I love SOVTs. I think they're an essential part of the voice toolbox.
Mhm.
And we have quite a bit of research on them, which is nice, to help support their benefits. But basically what they mean, semi-occluded means a partial closure or obstruction at the front of the mouth, whether that's a lip trill or a zzz or a v or buzzing through a straw, anything that partially obstructs the front of the mouth. That creates a back pressure that reflects at the lips back down to the vocal folds and helps to balance the pressure above and below the vocal folds so that the airflow is steady, and the vocal folds can come together in a nice squared up way or in a very clean closure way. So it helps to balance vocal fold closure, it helps to balance airflow, and then it also can help to balance resonance. Partially because when you do these sounds, typically they create some buzzy sensations at the front of your mouth anyways. But on top of that, if your airflow and your closure are balanced, you're more likely to be set up for good resonance as well. So it helps to really balance the three subsystems of voice. There are a ton of different types of SOVTs, which I think is also what makes them great, to the extent that usually you can find a good match for the person in front of you. It's just knowing that the same exercise might not be the right match for every person who comes in front of you. And so being really flexible with trying on different ones with people and making sure that it actually does make their speaking voice either sound clearer or feel easier afterwards. That's a really good way actually to know if something's a good fit for someone's voice. Making sure that's actually happening, because if it's not, that means it might not be the right fit. And especially if it's causing discomfort or strain, that's also not the right fit for sure. And as singing teachers or speech pathologists, they should be adapting to make sure they find the right match. There can be different reasons, though, why something might not be the right match. I think the biggest one is probably the amount of back pressure. So as much as that back pressure is helpful with balancing the pressure above and below the vocal folds, you have to get the right match of back pressure. For example, my voice actually really likes really high back pressure because it helps me to bring my chords together more easily. Something about that is a match for my voice in a way that it's not a match for other people's voices. So I like a small coffee stir straw, sometimes one, sometimes two. That works really well for me, but that certainly would be way too much pressure in other people's voices. The other big factor would be the shape of the exercise. So voicing through a straw actually changes the shape of your instrument. It lengthens the vocal tract. And while that can have some benefits, that may not be the right match for someone's voice. Depending on like their facial structure too, a V versus a Z may feel more comfortable or not comfortable to somebody. So there's a lot of considerations, I think, when someone's picking an exercise for someone, and you really have to make sure you get the right match.
Mhm. Yeah, there are, I mean, when we're first kind of, if we focus in on the straw phonation and straw
Yeah,
exercises, how big the straw is matters. How deep you are in the water
totally.
matters
Yep,
and can change things. Um, so even just within straw phonation, there
right,
are so many things to be mindful of, is this right? Does this person need
totally.
a bigger straw? Does this person need a smaller straw? And then, starting in water, and then what happens outside of water, maybe even covering up half of a straw before bringing
Totally.
them to a smaller straw.
Totally. Yeah,
Uh,
there's a lot of ways to play with those variables. Um,
mhm.
and you'll learn so much from just asking the client. If you just ask about how they feel when you change those variables, you'll learn what the right match is. And so it does break my heart when people feel like, oh, something must be wrong with me because the teacher said it should be working and it's not working for me. So obviously I'm the problem. And it's like, well, actually, no, they're not adapting to you and they're not adapting to what your instrument needs. It's really not your fault. And so it makes me really sad because I've been in situations like that before, and it's really discouraging as a singer.
Yeah, it is. That's when, I mean, I don't say this out loud to a client, but I do mention it in classes sometimes.
Yeah.
That is not in and of the artist or the person that's taking it. It's in and of the teacher that they're not entirely sure what else to do or where to lead you.
Yeah.
So we want these tools in our toolbox so that when it doesn't work for someone, we can
Yeah.
take them somewhere else. So
Totally.
if we're talking about kind of straw phonation, but then you also mentioned lip trills and V's and Z's.
Yeah.
And so kind of, can you talk a little bit more on that, on kind of like how you would incorporate some of those? Would you incorporate those first, or who would you incorporate those first before straw? Or,
Yeah.
have you tried straw and maybe they're not working, so you transition to that, or vice versa?
Yeah, so actually the SOVT I start with everybody in on their first lesson is a tongue out drill because
Mhm.
I like to use that for assessment purposes about tongue tension. And so that's
Mhm.
what I usually start on with everybody. And assuming that it's a good fit, that's their initial SOVT for a while. If it's not a good fit in the lesson, whether it's either getting diminishing returns for some reason or it just doesn't seem like the right three subsystems of voice balancing thing, at that point, I usually move to some Z's and V's and maybe kind of mix it between Z's, V's, and M's and do some work there and see if that direction is better. And then I also might try a straw at that point. But tongue out trill is usually the one I start with just because most people who come in to see me, for whatever reason, the demographic I'm working with, a lot of people benefit from them. So we usually
Mhm.
kind of start there, get some things unwound, and then at that point may go to different SOVTs. So that's my usual process. Now, if I was working in a different demographic, that might not be my process. I might prefer, I think one of the more neutral forms of straw phonation, for example, is a regular size straw in about an inch of water. That's a pretty neutral amount of back pressure and a neutral size of straw that is kind of a good starting place. So if I'm trying straw phonation with somebody, I might start there and then play with the water situation, then play with the size of straw situation and go from there. But that's about the general size I would start with that is so middle of the road, it might be a good match for most people.
Mhm. I want to go back to this tongue out drill
Yeah.
because I was surprised, very surprised when one of my, because I did not know this. This was about a year ago, and one of my clients taught me that you can do top lip and tongue, and you can do bottom lip and tongue, and you can do both lips and tongue,
Mhm.
which I cannot do. I think
Yeah,
I
I
only
don't
do
know how to
top
do that
lip.
either.
But the fact that it can be broken down, and this particular client actually was able to train, she could not do it at all when she first began.
Wow.
And then she was able to start her lip or her tongue trill with the top lip or a bottom lip. And then she was able to do top lip. And then she was able to do
Both.
all three.
Wow. That's amazing. I don't know if I've ever tried all three. I have tried both the bottom and the top, and I have no research for this other than my opinion. I think on average, the bottom lip might be the one that is the most efficient from like a airflow managing standpoint and a jaw
Mm.
relaxation standpoint. However, I do think it also has a lot to do with probably someone's facial structure. And so I do have a number of students who can only do the top lip one and it still works super well for them. It's just if someone's on the fence between being able to do the top or the bottom, I usually kind of gear them towards the bottom lip one, but that's purely anecdotal opinion of mine. That's not, I have no
I'm
like research
curious, do you
off the top of
notice
my
that they are on those students? Do you notice that they have like a retracted jaw that do with top lip?
Oh, it's,
That'd be interesting to
I'd have to figure out if it's a
attention.
specific type of jaw tension. It it just seems and looks a little more locked than
Mhm.
just kind of having everything be more zen, if you will. It's more of a general assessment, not a, oh, their jaw is specifically tightened in this way or something.
No, I'd be so curious to
Yeah.
see if I don't know what I do. Oh, it's
Oh yeah,
lower.
bottom lip, yeah.
So mine's lower, but I cannot do upper. You
So I
just
can
can't.
do the upper, but I have to hook my jaw funky to do it.
Yeah.
And it feels like a lot more air resistance or something to make that happen. So again, I have no research for that other than just my opinion. And so it's something I kind of explore with my top lip people to see if they can gradually do the bottom lip. And for the most part, I would say 75% of them feel like once they learn the bottom lip that it is easier and sounds better. But again, very much just observation, not actually based on something.
Oh my gosh. Okay. So I want to reach back out to you in 6 months, and I want you
Yeah.
to see on the people who do top lip, is
Yeah.
their jaw protracted? Is their jaw
Okay.
retracted? Like,
Yep.
is there a parallel
Is there a
between
parallel? Yeah, being able to.
the presentation of their jaw and
Yeah.
what they're able to do? I'm just so curious about
I
that
know.
component.
Yeah, totally. Okay, I'll keep an eye out.
Okay. Cool. I will too. I will too.
Okay,
I don't do a lot of lip trolls at this point, but I'll include them and
good. And take some data.
and take some data. I love lip trills. I include them in my work
Yeah, totally.
my personal work all of the time, and I include them in my vocal resilience class,
Oh, cool.
but I don't include them a lot in my private sessions. So
Oh, interesting.
maybe I'll
Yeah, a
start.
fun one to play with. Yeah, I would say probably about 80% of people I work with really vibe with tongue out drills. It seems, but again, my demographic is, uh, I don't know, it's something about that. I think it's just that it's not been tried, or tongue stuff hasn't been addressed really ever for a lot of the people that I see. So something like that is such a quick release that it feels like they get a lot of bang for their buck with that, versus if someone had been exposed to it early on and tongue work early on, I don't know if it gives them as dramatic of a result, but it just seems to be a missing component of technical training for people when they come see me.
Hmm. Well, I think there's a lot, what I've found, at least from where I am in the industry, that a lot of times any kind of tongue tension, it's like, I'll just grab your tongue and stretch it out of your mouth, and which we do for a neuralgia. We don't even do that in anything else. So I've only actually done that on 2 clients ever.
Yeah,
Um, so it's interesting, and I'm not saying anything bad about that, other than you
yeah,
can strain a tongue. So you
yeah,
just
totally.
be very careful if you're
Yeah,
going to do it that way. But that's sort of the go-to for a lot of voice teachers, not knowing that there are other things that we can do for the extrinsic musculature
right.
of the tongue, and there are other things that we can do for the intrinsic and the dorsum of the tongue.
Yeah, completely. I think also, how to put it? I think a lot of the tongue out work, I think in short bursts and kind of initially can help to release some tongue stuff. So then you can actually hear some of what else might be going on. Because there may be reasons that the tongue is grabbing and tensing as much as it is. And so just having it out briefly and kind of seeing if that relieves something. And then it helps, I think, unwind them. So then you can actually work on other stuff that then helps keep the tongue from over getting involved in the first place. But I do think the short burst is important because it is very easy for a tongue to kind of cramp or get locked or get stuck in that way. Yeah.
Yeah. I think too, just as long as the amazing thing with any self palpation and self
Mhm.
is that people will go in because, especially if we're using our own
Yeah.
hands, we have 2 points of sensory information coming into our brain. We have
Yeah.
what we're feeling here and what we're feeling wherever we're palpating.
Right.
So I think that it gets a little lost as to how deep of pressure or how far into a stretch we're going or
Right.
pulling, because
Right.
we're concentrating on one sensory information over another.
Yes, totally. It's interesting when I work on manual stretches of the tongue for people, we get really specific about if you grab pretty far back, you actually don't have to move it very much. It's maybe
Mhm.
a millimeter or two. And then it's really important that it's just the muscles in the back. It's not the frenulum underneath the tongue, that you're not really pulling at all those attachments. It just should feel like the slightest muscular stretch, not the attachments under the tongue. And yeah, if you reach far enough back, you really don't have to move it very much. It's just a millimeter or two, and that's enough. And so I think that that's really huge to be very specific. Because I remember when I first learned tongue stretches, somewhere along the way, no one ever specified that, and I did pull on my frenulum, and it hurt really bad.
Yeah, and that's the point. That's the area of the tongue, right down there by the frenulum and by the extrinsic musculature, that often gets strained.
Right, and
And
that's
then
not
someone
what
comes in to see me and they're like, "My tongue," and I'm like, "What happened?"
it's like. That's not
So
what you're supposed to be stretching.
yeah, I mean, I'm so glad that you just said that,
Yeah.
because that difference and that
Mhm.
specificity
Is
is
really
really
important.
important.
It's not just that you pull on your tongue, it's a very specific, yeah. And I think having someone guide you through that is really important. Yeah. And I try to be, if I ever post educational content, try to be very specific about that as well, because I again personally had that issue when I first learned about the possibility of tongue stretches. I think it's confusing because people think that that's what you're stretching or something, and so they accidentally do that, but it's really not what's supposed to be stretched.
Mhm. Yeah. I'll lead them through different drills of jaw stabilization with
Mhm.
tongue,
Mhm.
which I've found to be really helpful, where I don't have to then have them pull on their
Nice.
tongue, which is great.
Yeah, that's
Um,
awesome.
but I think that, yeah, the difference, or how, where you're able to begin with them and explain that. So I hope that those who are listening, voice teachers, having that some very simple difference is key and really important with that component.
Super important. Yeah.
Yeah. Amazing. So I know that we just have a few minutes left. And you have a very, a growing studio, and you're just blossoming, which I'm so excited to see. And your work, I've just been following your work and following you for years. We've been emailing for years and co-treating and everything for a long time. So I'm very grateful to have you as part of my team. But I do want to just, if there's anything you want to tell the listeners about your growing studio, about where you are, what you're doing, I'd love to let them know.
Yeah, cool. So I think one of the most exciting things about the Voice Studio, or SKB Voice Studio, if you will, is we are growing and we are starting to have different kinds of specialists come on the team. So we started with me, who is a speech pathologist and a voice teacher. We have a couple of speech pathologists and voice teachers who joined the team. Now we're about to bring on some performance-based voice teachers to have that acting specialty in conjunction with vocal technique. And then we're about to bring on also a vocal, like, growls, distortion, scream technique person who
so important.
with a lot of experience in vocal rehab. So he's going to be helping our performers who want to have that sound access in their toolbox be able to do that safely. And then the other thing that we added was not so much directly singing related, but we added a mind and body wellness coach at our studio who, Sophie's awesome. She has a master's in voice performance, but then also in psychology, and also has been a personal trainer for a long time. So she is offering performance anxiety coachings as well as fitness training for our performers to make sure that we're treating our singers so holistically, because it is very much a mind, body, spirit kind of thing with singing. And so we're trying to make sure that we have specialists within our studio to help across the board with the holistic training of singers.
That is so awesome. I'm so glad that you're able to provide this community for a lot of the artists in New York City. So thank you so much for coming on and having this conversation with me. Thank you for all of your work in the industry, everything that you're providing for these amazing artists to keep them up and able to do everything that they're wanting to do. So thank you so much.
I appreciate it. Thanks for having me. It was so great to get to talk with you.
Yeah, you too. Thank you all for listening. If you enjoyed this podcast, tell your colleagues, students, and friends. Subscribe, rate, and please write a review. You can find us on Instagram or Facebook, and feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on The Visceral Voice.